What age does perimenopause and menopause start? So first, let's talk about the difference between the two. So first, let's start with the definition. Menopause is not having a cycle for 12 months and 1 day. That's the scientific definition. And the age range in the U.S. is around 49 to 51 years of age. Now, there may be someone that's in their 60s that's saying, you know what? Well, I'm not in menopause yet. I still have my cycle. And that's why it's called a range, because there's some people in their 40s that may be having it, some people in their 60s, but that average range is between 49 and 51. Now, perimenopause means around the time of menopause, and this is that period of time before menopause, but you're still having your cycle. It may change, it may be different. You will start to see some signs and symptoms, and that is the most symptomatic time for some during the entire menopause transition. So still have your cycle. It could be 3 months since you had a cycle. They could come closer together sometimes. You could get them every 2 to 3 weeks. It just depends on the person. So I like to see a change in your cycle because your hormones are fluctuating up and down, and that's why a lot of times you'll start to see a lot of signs and symptoms then. But this just means around the time of menopause, and that average age is typically between 35, mid 30s, or late 30s for some people. It just depends. Some people may not even experience perimenopause until their 40s, but people have been shown to actually have signs and symptoms in their mid to late 30s. And a lot of times we're waiting for a hot flash to see that as the first sign or symptom. But there have been studies that actually show that mental health can be some of the first signs that we see in perimenopause, and we don't even know it. If you're having signs and symptoms that are unbearable, that you just cannot take, make sure that you talk to your healthcare provider. They should be able to help you and talk to you about perimenopause and menopause. And I also have a free checklist in my bio that helps you get that conversation started with your healthcare professional.